trials and tribulations. I am here today with
Nurse Chelsie.
I love that, Nurse
Yeah,
Chelsie.
thank you.
So where are we?
So we are at Cube right now. So Sarah Russick, she is the owner of Cube Studio, and she does micropigmentation, permanent makeup, and so I actually rent the salon during the week from her, and yeah, that's where most of the magic happens.
But you have some exciting news about a salon.
Yeah, so we're opening up a salon in Fawn Hill, so we're hoping to be in there in September. So we're doing that in collaboration with T's Hair Salon. So that's Laura, and she does hair extensions and hair coloring.
That's amazing.
Yeah, so we're so excited.
So I don't like to talk about COVID because I'm like, everybody is so over the COVID talk. But it brought you to still be able to open up a new salon, which is really refreshing because so many people are focused on all the negative stories that nobody's hearing about businesses that are still thriving.
That's right, yes.
You were closed down.
Yes, so we were closed down. As medical professionals, we were able to be open a bit longer, I guess, than some other businesses who were doing more beauty stuff. So we actually bought the building in November, and then we've been renovating it since then. So our husbands have pretty much been doing everything.
Thanks,
we
husbands.
I know, we literally don't see them. They're there like every night. So yeah, we're super blessed that they're able to do that for us, and we don't have to pay for the labor. We got a really good deal on the building when we did buy it. It was a complete disaster. Like, they've literally had to reframe and like new windows, new siding, like new everything. Like, it was really bad. So it's been a disaster. But we have 2 apartments upstairs, and then we have 2 commercial spaces in the bottom that we're going to utilize for our space. So
that's amazing.
Yeah,
that's a big project.
I know. Yeah, it was really big. So,
but I was saying earlier to you, I'm like, nobody's allowed to touch my face.
Yeah.
Only you.
Yeah.
So like, obviously.
Thank you for trusting me. Yeah.
No, and I was even thinking, I'm like, that just shows like you as a person and your skill that you obviously know what you're doing.
I like to think so, yeah. Obviously, every injector kind of has their own way of doing things, but, as you're practicing and growing, you take little pearls from people and then kind of make it your own, which I've been doing the last, almost 5 years. So, kind of develop my own techniques, and I would say, all my patients really like it and they're happy, so.
I think the biggest compliment that I get is nobody realizes how much work that you've done to my face.
It's not that much, but yes, like, that's what we want.
Yeah.
It's supposed to be like undetectable, right?
Yeah, and natural.
Yeah.
And I was talking to you about addictions and the myths of like Botox and all this treatment and the difference between the past and now.
Yeah.
But I was listing, like, I actually was doing one day, I was like writing down how much money I spent on my face.
Like,
and then I was like, you know what? I should just not look at that piece of paper anymore. But as women who are in this type of society, it's really hard because they give you all these people that you're supposed to look like or that you want to look like because that's what they're shown.
Yeah.
And then you're left with your body and like either through having children or whatever reason.
You're just aging. Right?
Aging. Yeah. And you're like, oh. So today we did...
Yes, we did radius. We did diluted radius for her neck, so she is a little bit swollen. So we basically dilute it, and then we use a cannula, and then we kind of disperse it through what we call tech neck lines. And it basically is for skin conditioning. So we help, with the skin condition as far as crepiness, the lines, texture. We just want to try to firm up that tissue a little bit. We're not really adding too much volume. It's not an area that you would want to add a lot of volume. Yeah, I mean, it's in so much motion all the time, right?
Yeah.
You can do dermal filler. You just have to be really careful with how people kind of pull in fluid in that. But by far, I think the diluted radius has been the best. So,
like, I'm so excited.
Yes, so it does usually take time for it to kick in because it does help stimulate your collagen, your elastin, and that's what we want to utilize to try to get rid of those lines is your body's own stuff. It's going to last so much longer than if you're, pumping yourself full of filler and having to come back every year, right? So you will totally love it. Give it time, but it's great.
Is it gone yet?
Almost.
It's gone yet.
Be looking in the mirror every morning, right? Is it getting better?
And that's funny because when I go to my beautiful producer, when he like takes photos of me, the first thing I see, I'm like, it's my neck.
And you know what? The biggest thing I've had my clients coming in for is since this whole COVID thing, everybody's working on their laptops, they're seeing themselves in Zoom, and now they're really focusing like what's going on with their face, their neck, right? They see themselves talking and, maybe gummy smile.
I also do that.
Yes, you do. But yeah, you pick up on it. I feel like when you're, you see yourself like that. Like, we don't usually spend that much time in front of a mirror. We get ready, we go to work, we're talking to other people. Now we see our reflection like constantly. So I'm finding more people are coming in wanting more treatments for, little things that we didn't think was an issue.
I'm like dumbfounded because I never even clued into that like I'm thinking back in the 90s, like there was
Yeah.
no social
No,
media.
exactly.
80s,
Yeah.
like they had nothing.
Yeah.
So they just did like beauty was always a
Right.
thing.
Right.
But
we
never
also
to this
had
extent.
Exactly, but we only had those around us to compare ourselves to. And usually when you're kind of in that same like cohort,
Yeah.
I mean, you're pretty comparable, and then we don't compare ourselves maybe to people in Toronto, right? Because
and
we
then
just
you didn't see them.
No, exactly, unless you traveled out there, right? So then I think it's the same with like all of a sudden, having bigger bums and doing like the BBLs. I think some people genetically, right, like Colombia, they are just blessed, and then once you start seeing pictures, you're like, oh, I want like a bum like that, and you see it all over Instagram, and now that's kind of the norm, right?
Why didn't I connect that?
You just don't when you're not on social media, right? But nowadays we're just so flooded with TikTok, Instagram, Facebook,
And you're seeing
whatever.
everybody from
Exactly.
everywhere.
So now it's just for women, you're just comparing yourselves like crazy. So I'm finding that is probably the biggest struggle is when my patients come in, they bring that filtered photo and they're like, make me look like this. And and I have to say like, no, this is, we're in real life. This is not a picture or a video. Yes, it looks great, but I can guarantee you most of them in real life probably look a little overfilled or, a little crazy, right? But it works for video and pictures. So
your TikTok was so funny.
Oh, thanks.
Because it is exactly
That's
a
exactly,
relationship.
yes, and I honestly have this conversation all the time with my patients because, like, I want the best for you. I don't, right? It's also my name on you, too, if you're walking around, right? Which we do in real life. People are going to see you.
They ask me all the time, and now look it. Now everybody's going to know. You're going to have over 100,000 people.
Which is great. I would love that. But, yeah, so she likes fun and stuff, right? Because, I am very committed, I feel like, to my patients. Like, I really want what's best for them. And I think that really shows because I, as a business owner, we obviously want to make money. I have no problem saying no, like turning down money because I think it's the benefit of it.
Oh,
right?
I know. I hated you last time.
Yeah,
because
I say no.
You said no to me,
Exactly.
and I was like, no, Chelsea.
Yeah.
I want them to look bigger, and you're like, no, Kay.
Yeah, you're
at your fullest capacity.
Exactly.
And I was like, I feel like we could push it, and you're like,
and it probably you love it in pictures.
I do.
Guarantee in real life you'd be like, it looks funny. Like you're gonna be like, there's something off, right? And we don't want that.
Because everybody calls them like the fish lips or the duck lips.
Yeah.
And then I was like, realistically, I think I'm right at the cusp where
you are. You're right. Like I would not do any more.
Yeah, I know you would. And I was just like, I look in the mirror and I'm like,
You're like, I can fit it.
I can fit something, and I know that you won't touch me because I already have comments, and they're like, "Oh, you really, you got your lips up." I'm like, "Don't tell Chelsea that, or she's
like,
not gonna do
exactly."
it.
But when it was funny. I think I was like looking through client pictures, and then, or maybe it was the 10-year one you posted, and I was like, okay, like when you see where she came from to where she is now, like what a difference. But we almost get so just used to seeing ourselves post lip filler that we just constantly think we need more, we need to change more.
I had no lips at all.
No, so that's what I mean. You have to look where you came from to where you are now, and it's like, wow, that's actually a crazy change. And
it's insane.
That's all you can kind of handle, right? Everybody's anatomy is a little different. Just because your friend had 4 syringes.
And I'm going to show you here.
She can
10-year difference.
Yeah. It's crazy, right? Like the difference. So I always have to, I love having, you have to have those before pictures. I have to pull them up and be like, hey, like actually look, this is where we started. This is where we are now. Like you might think you look hollow or have dark circles, but this is how much you've improved, right?
Yeah.
So that I think is super important.
And I'm super about being like authentic and genuine, and I always want to be like super upfront with everybody.
Yeah.
So you can tell them what you've done to me.
Okay.
Because if it comes from my mouth.
We haven't actually done a ton, which is good. You don't need it though. And I think you've like almost tried to convince me that, you maybe needed other things. I think you would talk to me maybe about doing chin filler at one point when I first saw you. And
I saw like this and I was like, what if we just like.
And when I first met you, I don't think you liked the dimple in your chin.
I hated the dimple, and I wanted that gone, and everybody loves it.
I love it too, and I had no problem telling you, like, I think it's unique to you.
Yeah.
I mean, obviously it's your choice. The golden ratio and stuff that we're told as injectors, obviously, is to have, like, more of a V-line face, not as much of a square chin, right? Just, V-er looking. It's just more feminine, but I feel like it suits you. It's you. I think it's super unique, so I have no problem telling my patients.
And the cheek, I want, because I said I wanted my nose. This is how insane women are. that like poor Chelsea, I would look in the mirror and be like, okay, this is where my nose is, this is where my mouth is, and it doesn't line up with this. I was like, Chelsea, you gotta like bring everything up on this side, and you're just like, it's a quirk.
That's exactly it. We all like, we are not symmetrical. Have you seen those like celebrity pictures where they show like if they have like the picture, and if they were to flip both of them the same, like the celebrity looks ridiculous.
Oh, because
if they mirror it or whatever, exactly. If they were like
like
symmetrical to each side, like they don't look good at all. Like we look good being not symmetrical.
Okay,
that's
so I did
that
so. TikTok where they do the what's it called?
I know exactly what you're talking about, like the face, like the
version.
Yes.
If there's something in front of it. But so I was like pressed it, and then my face went.
Yeah.
And I'm like, inversion.
Yeah, that's it. Yeah,
inversion. And I was like,
what happened, right?
Why do I look like that?
Yeah.
And that tripped me out.
Yeah.
Because my face literally was like this.
Exactly. Like if you look at somebody, like their eyes aren't going to be completely like level. And obviously we can use Botox and filler to try to, help even stuff out. But some stuff honestly is just meant to just let be. Like we're meant to have quirks. We're not all supposed to look the same. And I find a lot of girls nowadays, like, right, they kind of all look the same. And I don't know.
They're like, what makes them unique?
Yeah, exactly. We're kind of like missing that, right? So
we did.
So for you, we've done Botox just to help with some fine lines.
So the 11s.
Yep. So that's our glabella for frown, and then we've done forehead. So when we lift up, just to help with some of those lines and wrinkles.
But I can still move my eyebrows.
Yes. So she still likes having a brow lift. So we don't bring the Botox as lateral for her, so she's still able to lift up. But you can't tell that she had Botox.
No.
Like it's very subtle.
And I still have some lines.
That's what I mean. So, I mean, obviously we can personalize it. Some clients, right, they like to be more frozen, right? Maybe not being able to move their eyebrows. It's more of a personal choice. It would be my recommendation. It's still good to have some muscle movement, right? As we get older, the muscles just naturally atrophy. If you're not using them at all, what's going to happen in 20 years? You are not going to be able to hold your face up because you have not used those muscles. So that's why you really want to make sure with your Botox, you're coming in for your treatments at least like every 3 to 4 months. You don't want to come in any earlier. You need to have some motion. You need to exercise.
Just imagine all these
women
are
it'd
just
be, it'd be so bad, right? Exactly. So, and then we've also done gummy smile. We've done lip flip, I think, for you.
Lip flip, gummy smile, and
have we done around your eyes?
No.
Okay, so I don't think you've ever needed it.
No, I'm actually like pretty.
Yeah,
like I don't have a single.
Yeah, there's really not much there. So that's basically when the muscle contracts, we get a couple little lines, usually from sun exposure. That's a big one. So just make sure you wear
sunscreen and water.
Yeah,
we were talking
hydration.
about water.
Yeah. So filler wise, we've done your lips, I think, and that's really about it. And we did the hyper diluted radius today. So yeah.
And I did a really a fun video.
Yeah.
So you put in a port.
Yes. So it's basically a needle. We poke a hole, and that's considered our port. And we use a really long looking needle. It's about 2 inches long. But it's blunt at the end, and it has a little hole. So we put it on our syringe, and then we push the product out through there. And so the whole purpose of it is so we're able to access areas from farther away. We're also able to bump out vessels to prevent any kind of like occlusions, bump out nerves, ligaments, and then we're just not stabbing you a million times with the needle,
which
right?
I appreciate it.
Yes.
And it didn't hurt.
Exactly. So I find it's kind of a 50-50. I find some of my clients find the cannula pretty uncomfortable. They feel pressure. And then the other 50 love it. So
is it bad that I actually don't remember who recommended me to you and how I found you?
No, I honestly don't remember either. I think you came to me when I was I at Bronze Envy when you came to me the first time or no?
Yeah.
I think so, yeah. The tanning salon.
I feel like you were related to somebody.
Honestly, can't remember either. It's been like 3 years, right?
Yeah.
I know, it's crazy.
Because somebody was like, oh, you want this, you have to see her.
Yeah.
And I was like,
well, thank you,
okay.
whoever you are.
Oh, no.
I honestly can't remember either. I don't remember either, honestly, so I'm glad you found me.
So I met you 3 years ago.
Yeah.
You started at Bronze Envy.
Yeah.
You had this like tiny.
Yeah, it was literally like a closet. It was so bad.
Oh, and I was getting my IV. That's it.
Yes,
the IV.
Yes, so I think we were doing IV hydration because you've been so sick and stuff, but then the problem can occur when you're trying to put an IV in. If you're already so dehydrated, it can be really difficult to try to find a vein, which is what we struggled with.
Yeah.
Trying to like find a vein for you, right? So, yeah, and that's when our journey pretty much began.
I was so sick. I was like vomiting.
Yeah,
like,
you were extremely sick. And I think we did IV and lip filler that same day. And it was like in between me trying to fill your lips, you were like running to the bathroom. Like it was,
And I think because I swallowed the numbing cream and I have anxiety. So my biggest pro tip from somebody with anxiety is don't swallow the numbing cream.
Or dental block. dental block is really good too. So
Yeah.
you're pretty much numb from your eye to your chin. It's like going to the dentist, but then you're not getting the lidocaine and stuff in your mouth. So yeah, and you literally don't feel any of the pokes. It's amazing, like best thing ever.
I love it.
Yeah.
So as an injector, we were talking about addictions.
Yeah.
Because again, we're gonna go back to like what we were first talking about.
Yeah.
Women are constantly comparing. Women constantly are filled with insecurities because of other women, because of their partners and their spouses social media, and they're constantly feeling not enough. I think that is like a general, they don't feel enough. So I know you are always on the natural side. But do you think all injectors, like, or do you think there's some injectors that are like, hey, you want it? I'll give it to you. I'll take your money.
100%, right? I think everybody has their style, right? It's a relationship, right? So if I had a client that came in and she wanted those big cheekbones, really, really big lips, overfilled and that, for me also as a medical professional, like I can maybe sense that there could be a mental health issue there, right? So I try to talk to them asking why maybe they want the big lips. Like, did their significant other convince them maybe that's what they wanted, right? And maybe they truly don't want it. So there's little things you need to dig a little bit deeper into, and then some of them just want it, right? So for me, I have to be honest and say, that's not really my style. I can give you a contact for an injector who does do that, right? Like, and for me, they're ethically, I can't say that there's something wrong with that, because it wouldn't be appropriate for me to say to you, you can't have big lips. It won't look good. You can't have big cheekbones. Like, no, you are entitled to have what you want, right? So that's not my place to make that decision for you, or really try to convince you. I can give you my opinion, right, as a medical professional, on how it might not be safe, but I'm still going to give you that contact to somebody you would have a better relationship with. So there's a lot of things you gotta be careful with.
I didn't even think about the mental, like, is it like along the lines of like body dysmorphia?
Yeah, 100%. And that's where you get into issues where you start filling somebody's lips, they don't realize where they came from, and they literally look in the mirror and still see, maybe the petite lips they had before we even put filler in, and think they just need to go bigger and bigger and bigger. And you have to make them realize that there might be some kind of a mental, struggle in there, and that's also something you need to address, right? This is probably not your answer. So, and it does hit safety issues, right? We're full of blood vessels. Once you start putting filler in there and it becomes overfilled, there's always a risk with filler of it injecting into an artery or a vein. And obviously we're trained to recognize those things and be able to dissolve it if there was an issue. But you can also get an issue with compression. So it's basically you have so much filler in there that's collecting fluid, it can actually compress an artery or a vein. It's like pinching a straw, and all of a sudden now you're not getting blood to that tissue. So it can be dangerous. You really have to be careful. So for me, it's not worth that risk, and I just don't feel ethically comfortable doing that to people, right? So,
and that's like a perfect segue into like the big meat of the bones of this interview is I was also mentioning to you and my producer that nobody's allowed to touch my face other than you. even after like our first where I was, you were probably terrified because you're like,
no,
oh my
never.
God.
Oh my goodness.
You were so calm and I was losing my mind.
That's my job though, right? I have to be calm. So.
And I remember you're like, I think you gave me like
I gave you
rockets,
right? Because your blood pressure, you're getting dizzy, right?
Oh my gosh.
You do have to remember as well, like I did come from a nursing background. I am a nurse. You have to be a nurse or a medical professional to do this. We still need to be able to recognize, primary care issues such as mental health, issues with blood pressure. I've had clients come in where, all of a sudden they see that needle. You can just see they go pale, they go green, they pass out, they puke. You have to know how to handle these people.
Yeah.
I did have one client, she literally like seized up. She was like convulsing and then she puked all over herself. Like, we are prepared with tons of medications in case something happens, allergic reactions. People honestly think this is like getting your nails done, which is also kind of a root of an issue. They think it's just such an easy thing you can come in and do, and that's it, right? There's no risks, there's nothing. And it's like, no, these do have risks. There's a lot of things you have to look out for.
So for our audience who are watching today, I really, really, really want to like stress how important it is to choose your people wisely and to make sure so can you give them maybe like what to look for, what are some red flags,
as and for your injector?
For your injector and as somebody who you're looking for somebody.
Yeah.
And Because I know for me, like how we started, it's not like you have this medical office.
No, exactly, right? So it could look, you're probably like, wow, this is like sketchy. She's literally like in a closet. Right? Like this is like
where we started from the
right,
bottom.
Now we're here. That's right. And now like we're buying a building and stuff, right? So yeah, I feel like give us a chance, if we're kind of like in a closet, like. But
also like if they're in a closet, like
you do
let's
need to do your
talk
research, right?
talk about that. Like what are the red flags? How do you know you're safe and that that's I think my biggest thing.
Yeah. So when you go in anytime, like to meet your injector, it's okay to ask them questions about their qualifications, what kind of education they've had.
And to see them. Right?
I mean, you need to be a nurse and then you take a course to do injections, right? It's a continuing education thing. So I find though if you kind of put them on the spot and they're not prepared to be answering those, you'll know right away if they're telling the truth or not.
Yeah.
Right? Because they won't be prepared and they won't be able to like name off like trainings they've done. So it's a good thing I think to sit there and be like, hey, so like what kind of trainings have you done? Where have you gone? Have you traveled abroad? Have you trained with some, well-known injectors or whatever?
And if you travel abroad and you get all your training and that's where they say they get it, is it equivalent?
It is. The only thing that it could be an issue, I guess, is that let's just say like we're Canadian and we go to the States. Am I not allowed to say that?
No, yeah, you can.
We might not be able to inject in the U.S. So prior to doing your stuff, you have to, be in contact with that injector, seeing if you are able to do injections. You might be able to only observe. So it kind of depends on the country and stuff, but you are able to take that education and come back and put it into practice.
So it's still relevant.
Yeah.
Okay.
So you want to ask them also what kind of medications they keep on hand, right?
I did that to you today.
Yes.
I said,
exactly.
So if I die.
If something happened, right? And so that's my job is to have a kit. We have an emergency kit. We have stuff to help like dissolve filler if, it gets into an artery and we recognize something's wrong. We have all kinds of different stuff for allergic reactions. We have like the tablet form, EpiPen, injection, Cialis, which is funny enough, we keep to also use for if we have an occlusion. We literally have so much stuff, like it's so important, right? So they should not be injecting without some of those medications on them.
Yeah.
It is imperative. I also feel like you just want to kind of get to know them, right? You're going to know if you vibe or not, or kind of on the same page. Looking at their professional pictures too, like on Instagram and stuff,
huge.
right? Like they have huge lips and you're like, I want natural. This is probably not your person, right? Like that's okay. That is totally okay, right? So I think anytime you see that injector, you sit down and you ask them those questions. So
I know the biggest myth with what is
beside a highway.
Angry.
I know the biggest myth with Botox is everybody's like, why are you doing this when you're so young?
Yeah.
So I know we had a massive conversation about it, and I would love to like bring it to this table now because, well, you'll explain.
So I find like anytime you mention that to people, they're like, and to be totally honest, before I even got into medical aesthetics, when I was just in primary care, somebody had convinced me to actually take this course because I was very artistic. And so they thought I'd be a good fit, but then I was like, that seems so stupid. Like Botox, like that's not nursing, right?
Yeah.
But once you actually get into it and realize the amount of anatomy that goes into it, it is insane, the science behind it. So now I have so much more respect for it. And so I really try to explain that to people and they're like, ugh, you don't need Botox. Like you don't even know how it works, right? And like you had shown the audience, like even lifting up, you can still see that you have some lines. Like you try to frown, stuff can still move. You can still look natural. Exactly. You don't need to look frozen. There's certain areas we can kind of freeze that you wouldn't know, right?
Yeah.
So like people can't really tell that you can't frown. They can tell when you can't lift up your eyebrows, right? That's pretty much a dead giveaway.
Yeah.
So basically, we love being able to start early, so before those lines etch into your face, because once you start seeing some of those lines at rest, it's going to be so much more difficult for you to erase them.
And let me tell you, when you hit your 30 wall, it's happening.
Yep, it does.
They're going to come in.
Exactly. And I've had some clients who are as young as like 23 who had to come in just because they're so expressive with their faces that they've had. Right, and so we almost like baby dose them as preventative, just to keep some stuff from coming in. Because if you come in maybe when you're 50, I mean that took 50 years for those lines to etch in. Right, it's gonna take time to get those babies out. Like they're not just gonna be gone overnight, right? And so I feel like patient education is huge when they come in. Like I am not gonna be able to erase those in one day.
Oh, I tried.
I know, right?
I'm like, so let's do this permanently.
Yeah, you're like, let's get this done, right?
Yeah.
It's etched in over time, so it's gonna take time, right, for everything to kind of erase. So if they come in when they're 50, you're gonna start with Botox. It's pretty dangerous to do filler in the forehead, so personally that's not my go-to, but you'll probably need microneedling, laser treatments, chemical peels, right? It's a process, so you're investing in your face, which I think is super important. I mean, we have it forever, so, right? Yeah, exactly.
What's another myth? What's another biggest myth? Or the biggest concerns that people have that you found are the most?
Looking too overdone, right? So, like, for me personally, I don't think I look overdone.
You look so natural.
Oh, thanks. Like, and I think I do. And I feel like sometimes practitioners can become warped of what, like, they might think they look natural and they don't, right? So that's the other thing, actually. When you see your injector, you're going to know how they are by looking at them, right? What kind of work they've had done. So,
yeah.
Right?
You're like opening my eyes.
I know, it's crazy, eh? There's actually so much into this. It's crazy. So, like, for me, I've had like a syringe in my chin. I've had radius on, 1.5 on each side of my jawline, and my jaw's not even that sharp. Like, I probably use more, right?
Yeah.
I've had almost 2 syringes, I think, in each of my cheeks. And Botox. I do my forehead, my frown, around my eyes. I do my chin. And I think I've only had like 1 syringe in my lips. So it's crazy how many syringes you actually need to even look natural, especially if you've had a lot of volume loss. So, but I think people, they hear 1 syringe and they're like, oh my goodness, that's so much. Like, and it does sound scary, but it's so small, especially when you're talking like a full facial rejuvenation. So you could be anywhere from 5 to 10 syringes, easy.
The show is called Trials and Tribulations, and how I like to end the show is, what is your biggest trial and your biggest tribulation of like all that you are?
Oh my goodness,
and
that is a loaded question.
It is a loaded question.
Oh my gosh, I wouldn't even know where to start. Like,
I know. Is there like one moment that you were like, because of this, it brought me to here, or this was a moment, like, were there any like?
I feel like there are so many. Like, I started off with my PSW. So actually, to totally start over really quick, I took criminology when I was in university, and I thought I wanted to go to law school. And then while I was doing criminology, I decided to do my PSW, thinking, oh, I'll just make some extra money. Yeah. And then totally loved it. So then decided to branch from PSW to RPN, which is what I am now, and then doing my RPN to RN right now through Nipissing. So after I had done my bridging to RPN, I worked in long-term care for a little bit right before I had my son. So once he was born, though, I was like, I don't want to go back, which sounds terrible. It's just so much work, and then having worked there as a PSW, it's hard. So I honestly didn't know what I wanted to do with my nursing anymore. And I found I was so artistic. Part of me wanted to quit nursing and be like an artist. So I was like, what do I do, right?
Yeah.
And so then all of a sudden I had a family member mention like doing medical aesthetics. But I thought, oh, that's so dumb, like, I don't know, taboo. And then I did do it though, and right there, like, I knew that was like what I was meant to do. Like, I absolutely loved it. There's such an artistic approach to it on top of the science, which I think is just such an amazing combination. So now that I'm, doing this now, I just kept wanting to do better, right?
But I think that's a trial in itself.
It is.
That you switched. Like, I feel like so many people talk about change.
Yeah.
And it's okay to change.
It is, yeah.
And it's okay to switch paths.
Yep.
And I think that's also accounted to the tribulation of what you're growing.
Yeah, exactly.
Because you had to start from criminology, moving around, trying to find your path.
That's right.
That makes you happy, fulfilled, with a purpose.
Exactly. And
while being a wife with a mom.
I was just about to say that is probably one of the biggest trials was, my kids were so young doing this, like they were like 1 and 2, they're only a year apart, and then being married, right? You have other obligations, being a mom, being a wife, and then not to mention now starting your own business. Now you're not just going to work and coming home. You are doing your accounting, you are doing your advertising, you are answering messages, you are booking, you are also dealing with your clients from the day who are messaging you, asking you if this is normal. Like, it is so much. You don't realize how much goes into it, and there's days where I'm so stressed and just feel like there's not enough of me to go around for all those jobs, right?
Yeah.
So I've finally gotten to a point now where I feel like in the new salon I'll have a secretary, who will deal with bookings and stuff. I have an accountant, a bookkeeper to try to keep things separate. But you have to go through those trials in order to grow, right? So that you know where you need to go next.
And you probably, I know for me as a working mom, you have a lot of judgment
You do.
a lot of criticism.
Yeah.
Because what I've learned is that you're never going to make anybody happy.
Exactly.
And everybody's going to be like, you left your children?
Yeah.
And I was like, yes.
I did.
Yes, I did.
And I feel like we could have a whole other episode just talking about
Which
that.
I would
like,
love.
Honestly, because I am so open talking, about postpartum. I did struggle with postpartum depression, especially after having my daughter. I had a really hard time adjusting. Before even getting married, I did not see children in my life. And then my husband kind of opened my eyes, and I knew I would love to have children with him. But I never pictured myself being that stay-at-home mom that wanted just to stay home. And there's nothing wrong with that. I just couldn't.
It's just a gender norm that
that's
society
associated with it, right?
Yeah.
My husband's like, I have no problem staying home with the kids. You go do your thing, right? Which I think is fantastic. I just couldn't do it. I needed something. I don't know what, but I feel like I'm just so driven. I knew I had lots to show the world and prove almost.
And you are.
Yeah, I hope so.
And we're here.
Yeah, exactly.
And I'm so proud of how far you've come.
Yeah.
Because even in 3 years, what you've grown was absolutely
I know,
remarkable.
which I can't wait till you're in the salon and we're like, I was in a closet and now I'm in this whole salon.
Legit.
And we're already talking about opening a second location somewhere too. So I'm super excited and hiring other injectors to have work for me and stuff. So I'm super excited. But I definitely feel like just going through, parenting and being a mom is such a struggle with having your own business. So
and we'll definitely have to have a part 2 to talk about, because I want to get a bunch of working moms together.
I think that would be amazing.
And this will be a huge thing.
Yeah.
So that's another tale of triumph. And that's with Chelsea today.
Yeah.
So
thank you so much for having me.
It was so much fun, and I'm looking at a mirror right now for all of you
who are looking.
And I'm just I'm so excited.
It's going to look fabulous. Give it time. I feel like patience is a huge thing. Everybody wants that instant gratification.
Instant gratification. That's society now.
Yes.
Instant gratification.
Yeah.
Swipe right. Swipe
left. That's right. But 100% you're going to love it.
Things gone.
Yes. You're welcome. Thanks for having me.